Hello friends, how are you all? Today we are going to discuss about coronary artery bypass graft, which is CABG surgery, and its CPT coding guidelines, which is important for CPC exam and surgery coding. And this video is presented by #1 Medical Coding Training Academy, Thought Flows. It's a place where you can learn medical coding in an easy way with multiple languages.
In today's session, we will see what is CABG, what are the common diseases of coronary arteries, coding guidelines for CABG, and with some sample charts. This is a common question in various medical coding certifications.
Without wasting the time, we will start. Coming to the heart, which is a central pumping organ that will pump blood to all over the body. In language of medicine, we will call heart as cardio or corona.
As we know that heart will pump blood to all the systems of the body, but heart is also an organ that needs blood supply. The arteries that supply blood to heart are called as coronary arteries.
Now we'll see the organization of coronary arteries. The aorta is the largest artery, supplies oxygenated blood to the body. It gives up to two main branches called as right main and left main coronary arteries. The left main artery bifurcates into left anterior descending artery that supplies front and also bottom of the left ventricles and interventricular septum. It supplies blood to half of the heart muscle. The next branch is called as left circumflex artery that supplies to left atrium and back of the left ventricle. The left main coronary artery supplies left side of the heart. Coming to the right branch, it bifurcates into right marginal artery and right posterior descending artery. Both of these supplies right atrium, right ventricle and back of the septum. Let's see a glance of coronary arteries. The aorta gives up two main arteries called left main coronary artery and right main coronary arteries. The left main coronary artery divides into left circumflex and left anterior descending artery that supplies left side of the heart. Coming to the right main coronary artery, it divides into right marginal and right posterior descending artery that supplies right side of the heart.
Most of the cardiovascular diseases will be the cause of blockages or narrowing of coronary arteries. High cholesterol that forms fat or plaque inside the arteries. High blood pressure, normally called as hypertension, which damages the arterial walls and blocks the flow of blood. And even smoking that releases the chemicals into the arteries that damage the walls of arteries, and formation of blood clots that completely blocks or restrict the flow of blood. All the above reasons will block the flow of the blood, which results in heart attacks.
Coming to myocardial infarction, the blockage of coronary artery leads to very less oxygen supply to heart muscle known as myocardium. That results in death of the tissue called as necrosis, and this condition is called as myocardial infarction or heart attack. When there is any blockages formed in the coronary arteries means surgeons will go for different types of therapies. In that, stent placement is the one that helps in widening the artery or removal of plaque. If this is not successful, the surgeons will go for coronary artery bypass graft. CABG is a surgical procedure used to restore the normal blood flow to an obstructed coronary artery. This procedure carried out by the attachment of healthy blood vessel above and below the diseased area. The healthy vessel will be taken from other areas of the patient body. This is called as harvesting or procurement. The surgeon can harvest an artery or a vein. The commonly used arteries or veins are internal mammary artery, upper extremity artery or vein, and saphenous vein.
Let's see the coding guidelines of CABG surgery, from which you'll get one question in CPC exam. First of all, coming to the venous grafting, in which surgeon use vein as a graft. The codes are classified depending on number of veins used as a graft. For a single vein graft, use the code 33510. If surgeon used 2 veins, he had to use the code 33511. Likewise, for 3 veins 512, 4 veins 513, 5 veins 514, and 6 or more veins, we had assigned the code 516. And coming for the sample, a patient had a CABG surgery using 1 vein, so we had assigned the code 33510. And in the second scenario, a patient had CABG surgery using 3 veins, so for 3 veins, we had assigned the code 33512.
We'll see now how to code harvesting or procurement of veins. The harvesting of saphenous vein is inclusive in CABG surgery. That means this vein harvesting we should not code separately along with CABG surgery. Other veins like upper extremity vein harvesting will be coded separately with 35500 code. And for the harvesting of femoropopliteal vein, we have to use the code 35572 along with CABG surgery.
And now we'll see one sample scenario. In this sample, a 50 years old patient had CABG surgery using 5 venous graft, and which was harvested from femoropopliteal vein. So we had assigned the code 33514 and add-on code 5572. For 5 venous grafting, we had used the code 514 as we are harvesting from femoropopliteal, so we have to take the add-on code 5572.
Next, coming to the arterial grafting, here surgeons will use arteries as grafts for CABG surgery, and the code classification is based on number of arterial grafts used. 33533 is the code for single arterial graft, and 33534 is for 2 arteries, 33535 is for 3 arteries, and if surgeon is using 4 or more arterial grafts for CABG, then we have to take the code 33536. Let's see with an examples. If the patient is having CABG with single arterial graft, then the answer is 33533. And if the patient is having 5 arterial grafts for CABG, then the answer will be 33536.
Then, coming to the harvesting of arterial grafts, the procurement of internal mammary artery, gastroepiploic artery, epigastric artery, and arterial conduits are included and not coded separately. But the harvesting of upper extremity artery only should be coded separately with the add-on code 35600.
Now let's see the combined arterial and venous grafting. If the surgeon is used both arteries and veins for the CABG, we have to use both the codes, one for arterial grafting and another for venous grafting. But there is a twist here. We should not use the primary codes of venous grafting. Instead, we have to use add-on codes, and the code ranges from 33517 to 33523. That means for the arterial grafts, we have to use primary codes, and for the venous grafts, we have to use add-on codes. According to the number of veins used, we are having separate codes. 33517 for 1 venous grafting, 33518 for 2 venous grafts, and 33519 for 3 venous grafts, 33521 for 4, 33522 for 5 venous grafts, and 33523 for 6 or more venous grafts. All these add-on codes we have to use in conjunction with 33533 to 33536, which are arterial grafts. Let's see the example. Patient had CABG using 3 arteries and 2 venous grafts. So we have to take the code 33535 for the arterial grafts, which is a primary code, and an add-on code of 33518 for the 2 venous grafts used by the surgeon.
I hope you got a clear idea on CABG surgery and its coding guidelines. Now we'll see the key points. The first key point, you had search in the documentation whether the surgeon used an artery, vein or both as a graft. And the second one, you had check how many grafts used in the surgery. And finally, you had check for included veins and arteries. Now we'll see with the sample scenario. Here, patient is coming for an reoperation of CABG after 7 months of primary surgery. Here, surgeon used 4 venous grafts and that was harvested from femoropopliteal vein. So, just check the options. We can directly rule out B and D as these codes are arterial grafts. But in the scenario, they given venous grafts. Coming for the option A, so which is 33513 along with add-on codes, we should not use 51 modifier for add-on codes. So hence the answer is C. So 33513 is for the 4 venous grafting, and for reoperation we had used 530, and for the graft we had used the 572.
That's all for today, guys, and we will meet in our next session with another informative video. Learn, upgrade and expertise yourself in medical coding. Do subscribe to our YouTube channel. Follow us on Facebook, Instagram and Twitter for more updates. Till that, thank you. Bye bye. Take care.